My name is Scott Sanford, a co-founder and chief growth officer. I'll be hosting the call today. I've also asked, or recently announced, new executive to the team, Pat Sir, as our new president. He'll be speaking to you towards the end of this call, so stay tuned for some great comments from Pat. And I just want to welcome everybody. If this is your first exposure to Healthiest You, we certainly appreciate you taking time out to learn about what we do and how we can help your business, especially in this busy selling time of the season. So I know you all are booked solid and meeting with your clients and creating those benefit plans for them, which is one of the reasons why we feel it's very important for you to take a few minutes out and learn about Healthiest You, because we believe we've created a product that can help you certainly differentiate yourself from your clients out there, which is not an easy thing to do in healthcare today. You know, we've been kind of doing the same thing for it seems like 100 years, and not a whole lot has changed with product offerings and so on. So we think Healthiest You is a nice new product that is forward-thinking, that it's going to change the conversation with your clients in a good way. So, and if, of course, if you're joining us again because you've been in our Healthiest You world and you're just listening in to, like a lot of you do every month, to get a refresher and hear the latest and greatest stuff, we, of course, appreciate you. And some of these stats I've brought up here on the slide are, we have to thank our partners out there. So we at Healthiest You are committed to our distribution model of solely selling our product through folks like everybody on this call. So we do not take any groups direct to Healthiest You. We simply empower you and partner with you to bring our product to your clients, and that's how we bring it to market. So some of these stats I've brought up are, we do want to thank you for embracing Healthiest You, bringing it to your clients so they can experience the benefit. We had a 44% growth in membership just last month alone, and October is typically not our busiest month. Certainly December and January are. So we had an exciting month last year. We doubled the number of groups on the books. We've had 151 brokers registered in the last 48 hours, and that stat's about 3-4 days old. So the theme of the call is kind of the train is leaving. You see the picture of the train there. The train's leaving the depot. The folks that have brought Healthiest You to their clients, the feedback has been incredibly positive. Healthiest You is now becoming a necessity for benefit plan design, not just an add-on product as it was perceived a few years ago. We have 20 times higher utilization and engagement than our closest competitor on average. And we'll kind of get into that here in a moment. So one thing you're going to learn from this call is we're all about engaging our consumer, our member here, into our product. So you really see some major changes in the delivery of care that makes it much more efficient. We drive down costs and we increase productivity. And I just want to point out that there's 2 months remaining here, as you all know, for the big December and January business months. So we're now in, November 6th or 7th already. I just can't believe how fast time's going by. But now is the time to embrace Healthiest You and mention it to your clients. And we've got a full support team here at Healthiest You that if you don't even want to do the presentation to them, that's okay. Let us do it. We certainly don't expect you to be the expert on day one. We do appreciate an introduction to this product to your client, and we can either in person or via webinar, we're happy to do a demo for them. And I'm going to have Jesse Liston, who's one of our account executives and helps lead our broker support team, share a story with some great successes he's having with one of his many partners he works with across the country. When they simply just let him do the presentation to the group, we validate you as the broker, the consultant partner, and it creates a great win-win situation for everybody. So first, we want to give you an overview, just a high-level overview of our product for those that are new. We'll walk through this kind of quick. What do we do? What is our product? Feel free during the call to use the chat box here on the GoToMeeting control panel on your right-hand side of the screen there. Any questions come up as we're walking through this, please submit those there. Due to the volume of people on this call, we have to mute everybody, but we do our best to make sure we answer all those questions in the chat box. We'll review that periodically. So just to start, to give you an overview of our product, how we engage folks, is we offer them 24/7 physician access anytime, anywhere. It's called telehealth and or telemedicine. You may have heard this. It's becoming mainstream very rapidly. It's the fastest growing sector in healthcare, according to many different healthcare publications out there. It's gaining steam and momentum, and we believe now is the time where it's the tipping point. It is a necessity in benefit plan design, and it's just too valuable for the employees and the employer group to not have access to Healthiest You. We are going to combine that physician access with proactive health management content by our Chief Medical Officer, Dr. Kelly Travey. We want to keep people educated. We want to give them content at the time of need. We want to keep them healthy. We want to keep them out of that doctor office as much as possible. And then lastly, we're going to show them how to find the best prices on medications out there. Think Amazon.com and eBay, but for the prescription world, we're going to show you how to shop for medication. The pricing can vary substantially with different pharmacy locations. We're going to expose all that. First off, the foundation of what we do, over 70% of all doctor office visits can be handled over the phone. So you can imagine when you're not using the telehealth, how many of those unnecessary visits are ending up at that doctor office. They just don't need to be there. The physician access is 24/7, 365, all licensed and board certified physicians. They are based here in the United States. They're available by phone, video camera, or email. They can diagnose. They can prescribe medication. No, they're not prescribing OxyContin or medical marijuana. The DEA-controlled substances are off that list. But if you need a Z-Pack, you need some antibiotics, you need some light painkillers for a back issue, whatever that may be, there's a long list of items that they can prescribe medication for and avoid that unnecessary doctor visit. We're available in 49 states. Idaho is the only exception today. They've been a temporary hold by all telehealth providers in Idaho as they review that verbiage within their medical board. We do feel that that will be reversed soon, but today, 49 states. And we have the largest telehealth network in the country. It's about 10 to 15 times larger than our closest competitor. We have over 2,300 physicians in there that are waiting in queue for our members to get the care they need instead of the members waiting for the doctors. So we're going to flip up healthcare upside down here. Here are the top 9 reasons we visit the emergency room. We bring this up because this is almost identical to the top 9 issues that we resolve every single month on our telehealth platform in 49 states. Now, just to kind of validate the safety and effectiveness of telehealth as an industry, we reference this study by Journal of American Medical Association comparing telehealth to an office face-to-face visit. Telehealth did not have higher rates of misdiagnosis or treatment failure. This study was done over a year and a half with 8,000 patients. Those acute issues like the top 9 we just discussed, very safe, very effective to do right over the phone. Here's how it works. You call Healthiest You on an 800 number to schedule an appointment, or you can go online and schedule one. And as of January 2015, our game-changing smartphone app is coming out. It's kind of top secret, but lots of incredible technology built in to remind you at the time of the need that you have this benefit, wellness content delivered at the time of need, the ability to schedule face-to-face doctor visits with your own primary care physician or doctors in your network, price transparency for medications, tests that you may need to have done, lots of incredible stuff coming on, and I feel we'll be able to demo that to you here probably on our national webinar next month. We'll see how the IT team is making progress here, but it's coming together incredible. So when you're calling in or when you're filling out your information online, we want to make sure we have your medical history. We route the call to the appropriate doctor depending on the state you're in. The doctor reviews the patient history and then is connected to the member. Just as that doctor reviews your chart before he or she walks into the exam room, we're just turning this virtually. It's the same flow, but it's just done over the phone or video camera. If a prescription is required, we send that via e-script to the member's choice of pharmacy. You're traveling, you don't know where a pharmacy is, not a problem. We'll look one up for you. We've got a lot of employer groups with consultants, traveling, truck drivers, delivery drivers, airline pilots, and folks in the airline industry that, are traveling, and this is a great benefit for them. Doctor's going to update your medical record with the notes after that call, and if you want, we'll share those notes right with your primary care doctor. That's up to you. We're going to do a follow-up survey, check in, have you rank that experience, make sure you don't need any follow-up care. Average callback time, 9 minutes. So faster than you can get dressed, get your tennis shoes on, and get your car started to go to the doctor. You're already on the phone with the doctor, doing a consultation, resolving your issue, saving the copay or doctor visits, the fuel involved with the travel, everything else that goes with it. 30% of the calls are returned in under 2 minutes. We guarantee under 1 hour callback time from the doctors. Now, the health management platform. So our Chief Medical Officer, Dr. Kelly Traver, many of you may know her. She's a world-renowned physician and wellness expert. She is the former medical director of Google. She's on the Stanford Hospital Board, Stanford-trained physician. She's a practicing physician today. She loves working with patients, so we worked with her to develop a communication system that takes her great content that she educates her patients with, and we plug it into our members to keep them educated and let them understand the basics of being well and doing some things that can have a big impact on your life and drive down that personal healthcare costs, which translates to employer healthcare costs. So you access this online, mobile app. You can even order the book by Dr. Kelly. That's the foundation of this program. But we're going to engage the consumer. This is going to change with the new smartphone app. So this is the last time you're probably going to see this content delivered this way because we're evolving this. But great information here. You can create a personalized action plan. We're going to have videos by Dr. Kelly, high definition, that will be delivered at the time of need. As an example, you get diagnosed with allergies. After that consultation, what's going to show up on your phone is a video by Dr. Kelly focused on allergies. So some things you can do. She's going to educate you. Some things you can do to kind of mitigate those symptoms, maybe help avoid that doctor visit next time, and just keep you educated on your own personal health. So we can track all your progress here in the system. It'll sync with the Fitbit device, your weighing scales, your personal library of content. This is your go-to for good, healthy, basic 101 information that you can use to stay healthy. And we're going to combine it lastly with our prescription drug price comparison tool. Yes, this is built in the app. You can price medication anywhere. So you're leaving that doctor office, you're on that phone doing that telehealth consultation with the doctor. You pull up, depending on your health plan, shop medication. Simply put in the drug name, the location, city zip or address, where you're at or where you're going to be. Click find the lowest price, and it just does all the shopping for you. Every pharmacy benefit manager is loaded in. Every pharmacy location. Locations are plotted on a Google map right here. The exact cash price for each of those locations for that particular drug and dosage that you're shopping. This example, this is generic Lipitor. $16 is the lowest price at either a Sam's Club or a Costco here, some type of a membership warehouse, ranging all the way down to $73. This is the exact same medication. These pharmacies might be right across the street from each other. We had 2 great testimonials come in last week where folks say it kept $110 more in their HSA account on one medication because they use this pricing engine. And they went across the street, and it happened to be $110 cheaper. This example, it's almost $60 cheaper, $57 roughly cheaper for the exact same medication. So do a little shopping. You can do it on the app. You can do it online, but it can make a big difference. The feedback, and for those of you that are on the phone and have sold our product to your clients, you've experienced this. What's going to happen when you sell a group is, especially this time of year when we're in the very high utilization season for telehealth and just for healthcare in general. Seasons are changing. We're going into fall, going into winter. School's in session. People are getting sick. They're calling a lot more. Our highest call volume is December, parts of November, December, January, February. What's going to happen is you're going to have a testimonial come in like these we're seeing here. You'll get a call from the HR director saying, oh my gosh, this Healthiest You is a game changer. I had 3 people use it this week. Everyone's talking about it around the office. They didn't need to leave work for care. And you're going to be the hero because Healthiest You, we have a 97% satisfaction rating with our product on our surveys that we conduct. Now, before I introduce Pat, I'm going to jump over here and demo to you some of the tools we've created at Healthiest You to make it very easy and fun for you to share Healthiest You with your clients. So after this call, the first thing I would encourage you to do is go to HealthiestYou.com if you haven't done this. Click on this Partners tab. It's the green box, top right-hand corner. Click on that, create your own account. You'll have access to all of our online tools. This is your own private login. You're going to see our promotional pricing up here, which Pat's going to walk you through. Very aggressive pricing out there. Nice commissions built in for you. It's just a fun product to sell. You can get contracted in here if you have not got appointed with us yet. You'll see the number of proposals you've sent out here. Of course, first time you log in, it's going to show 0. The volume of those proposals, last 30 days activity, the weather. I know, I'm sorry for some of you in the colder regions. We're spoiled here in Scottsdale, Arizona. The task feed, your activity feed, health insurance news. So this is pulled from, aggregated from multiple different sources across the web. Of course, healthcare is an incredibly changing animal out there. So this allows you to keep on top of the news, and you can share this with your clients. Facebook it, Twitter, LinkedIn, email it. Go right to that article. You've got all the good content right at your fingertips if you need it. We can do email marketing here. Send a quick introduction to any client you want to about Healthiest You. Puts it into a nice HTML template, brands it to you. All of your contact information, your company name is going to be populated right here in this top-hand corner. They can say, click on these links, takes them to your own Healthiest You website that's automatically generated when you create your partner portal login. Show you what that looks like. Again, it's going to have your name up here. And the clients can come here and they can say, all right, what is this Healthiest You thing? You know, how does it work? I can watch the video. I can learn all about it, see all the stats, and request a quote. Comes right to your email inbox to you. A great prospecting tool. You can invite them on a webinar. This is just a short little 15, 20-minute demo of Healthiest You and why it's so important for them to have at their company. Again, that invitation's all branded to you. It notifies you when they watch that webinar. Time to follow up with them. You've got a hot prospect. We've got our ROI calculator. This is a fun tool for those self-insured groups. We know self-insured groups are getting smaller and smaller out there. We're partnered with some TPAs and some very creative programs that go self-funded down to 25 lives. It's just changing. So this ROI analysis is fun. Put in a self-funded group, you know, the number of employees, our pricing here, which you'll have access to, 1,000 life group. We're going to be a maximum of $6 price point on that, 0 for the family. Put in the number of doctor visits they're doing. You know, gosh, 20,000 employees, they're probably going to be doing at least 4,000 doctor visits. Urgent care, we'll just put 500 in. Emergency room, we'll put 300 in. The spend, average cost per visit, I'll just use some industry averages that we see here. 125 for primary care, 175 for urgent care. ER is usually about 1,100. We'll put it at 1,000. Let's say we can just redirect 10% of those visits. What's that look like? So we're going to redirect 480 visits out of these 4,800 total visits. So the cost per location here. So they're spending $72,000, and if they're just redirecting 10% of the visits, they're getting a 23% return on their investment. Not bad, not bad. So this illustrates that this is a great place if you've got a bucket of money here at the company to spend on benefits. This creates a pretty compelling story that Healthiest You is a great place to spend that money. I mean, a 23% return on your investment just redirecting 10% of the claims. Not bad. Not bad at all. I guarantee you they're not getting a return on their investment anywhere near that on any other benefits they're buying. We're going to show a 3-year snapshot. 3-year savings by location. Because first year is kind of the incubation period. Healthiest You is new to that group. Gets in there, you get people using it. Next year, utilization goes up. Next year, utilization goes up. We introduced the app here in January. Utilization goes up. So next thing you know, you're shifting the way people resolve their healthcare issues to a much more efficient manner via Healthiest You. We're also going to highlight absenteeism. So Pat's going to walk you through a couple case studies, very compelling, showing the shift in PTO days, the absenteeism being reduced, productivity being increased. This is all data coming back from your peers that send it over to us. In fact, if you've got some case studies out there that you've done, you've had Healthiest You in, you're crunching the numbers, and you're saying, wow, this is really compelling. Send that to us. We'd love to have that stuff here and share it out with our clients and partners. The environmental impact. You know, we pull data from EPA, U.S. Bureau of Labor, and the AMA to show miles saved, CO2 footprint, fuel savings. We get granular on this. The prescription savings, if you're using our shopping engine, can be pretty substantial for the employee. Wellness impact. So you can go back and you can redo some of these assumptions or send it right to the client as an interactive document, or print it off as a PDF, put it into your presentation booklet, and go kill the competition with that presentation, or renew that group. It's going to be a lot harder for somebody to come in and take that client from you. When you've got Healthiest You in, you're presenting this data, you're presenting our utilization reports that we're showing to you, and we're providing to you to meet with your clients that are going to look like this with the new app rollout, showing the current membership for that group, how many consultations they've done to date, utilization by year, quarter, month, monthly redirection, how many primary care, urgent care, and emergency room visits do we redirect? It's going to be this red box right here. Plan savings. We'll just do some very conservative average figures for visits and the cost savings to the plan when somebody calls and doesn't go into the doctor. The consultations by location, the top 5 diagnoses, we're plotting it onto a map so you can see geographically where these consultations are taking place. If you've got companies with multiple offices, people on the road, valuable data. We're going to package this up in a beautiful way, give it to you. You're going to come back and be the data hero for that client. You're going to show them why Healthiest You is the best benefit they have. So let's jump back. We'll wrap up the partner portal here, and then I'm going to introduce Pat. So hang in there with me. Proposals, interactive proposal system on this. Awesome. You got a group you present it to them, they like it. Create a quick proposal. Put the information in here. A few fields you're going to have to fill out, and it's going to look something like this. Here, it's interactive document. You can email or print it off. It's got all your contact information here. You can write a little nice little message to them that will show up in that message box. They can see the financial summary, the breakdown there for the cost for the group. They can learn more, how it works. They can accept this proposal, but they can read stats around this. So what are the stats around the product? What do the screenshots look like from the member experience side, right? What's the product video look like? Interactive document, when they open it, it notifies you. Lots of technology built into this partner portal. We built this from scratch, in-house, from the ground up for you to help grow your business. So if you want, of course, a personalized demo on this, we can get deep into it. There's so much stuff in here, but very easy to use, very easy to navigate, and not overwhelming. This is an individual enrollment page, so we can sell individual programs very easily. You got a client that's buying an individual product from you, send them the link here to your Healthiest You page. They can read all about it. They can enroll right on here, and we just pay you the commissions on it every single month. By the way, you can see your commissions in the partner portal or the commissions tabs here. Okay, so I think I'm going to just wrap up here the portal, the partner portal, HealthiestYou.com, green tab in the top right-hand corner. Click on that tab. That's how you can access it. Create your own account. Come in there and play with it. Schedule a little demo for us, a little webinar for us. We'll walk you through that. We've got a full support team. And you do have just the basic information in here as well. And I say basic. We've got the old school flyers in here. We've got the sales templates, PowerPoint presentations, anything you need here to get you in the Healthiest You business. Turnkey, ready to go. So with that, okay, I'm going to go ahead and introduce the newest executive at Healthiest You. He's about five and a half months in. He's a veteran in the health insurance and benefits, employee benefits space. He's been in the business longer than he probably wants to admit, about 30 years. He comes with a wealth of knowledge and experience, an incredible guy. I'm honored to work with him every single day. Love to have him on our team, and very well known in the space. But I want to introduce Pat Serb to provide some comments here with Healthiest You. Pat, are you on the line?
I'm here. Thank you, Scott. Good afternoon, good morning, everyone. Thank you for joining us, and I'm thrilled to be able to spend a little time with you today. And thanks for that introduction, Scott. Yeah, I think what I wanted to do is just, as Scott mentioned, I've been with Healthiest You now for about 5 months, and I just wanted to spend a little time, give you some observations that I have on the business over these first 5 months, and talk a little bit about what I really see as the big differentiators between Healthiest You and our competitors out there. And, first of all, I would just tell you, my first observation is what an exciting business this is. This is the whole telehealth wellness space that we're in. And really what we're doing at Healthiest You is so unique. It just makes it a lot of fun. And, for all of you on the phone, and there's a lot of you on the phone, we just can't thank you enough, because you're really the ones that are taking our message out to the employers, out to the employees. And, hopefully, our goal, I know this is a busy time of the year, but, hopefully you're going to come away with a few extra ideas. It'll help you, convey those to some customers, write some additional business, make your customers happy, the members happier, and ultimately you make more money. That's what we want to do, is help you make more money. But, it is, as Scott said, this space we're in is an exciting space. It's really a must-have now. And we're really on the front edge of a lot of technology. And I think that's really what makes us unique, what separates us. And, I think the biggest thing I would say in the first 5 months is I'm surprised we're getting as much visibility and traction. I expected it, frankly, to take a little longer, but we, again, thanks to you, are rocking and rolling. We are writing a lot of business. Our forecast through 1/1 is to probably triple our business, and so we're very excited about that. And I think at the end of the day, why is that? Well, I guess I think about this dog hunts. When I think about our offering, when it's explained properly to the employer, when they understand that what we are about is getting people to use a lower cost method of care that will ultimately shift a lot of claim dollars from those primary care, urgent care, emergency room visits over to Healthiest You, we're gonna save them a lot of money. It's that savings on the claims dollars. And so once that's been articulated to the employer, really the sale is not a difficult sale. And so I'll talk a little bit more about it. So let's, Scott, let's go to the slide around engagement. I want to just talk a little bit about this, because, this is probably the question that comes up the most. And that is when we talk about 39.75% engagement versus an industry average of 2%, people kind of look at you like, really? How is that possible? How can you be doing that? And I had the same questions when I first started looking at Healthiest You. Now that I've been here several months, I got to tell you, it's as clear as day to me. It's very, very clear. When you think about what we do, we sit alongside of that medical plan, and we are able, because we're not embedded and lost in the medical plan, we're sitting alongside of it, we are able to shine a bright light on Healthiest You. We are able to consistently communicate to the employees our value story. And so at that time of need, as Scott talked about, at that time of need, they're going to think about Healthiest You. And it's not, and Scott, do we have the slide on the fruit showing the different things we do? I really like this slide, because it's not apples to apples. Apples to apples is, yeah, we've got 24/7 access to a doctor. That's what a lot of other telehealth providers have. But what drives our utilization is all the other activities that we perform. If it was just one thing, everybody would be doing it, but it's not one thing. It's lots of things. And, it starts, just this goes through a whole lot of examples from our, from our marketing efforts, from our fulfillment. Everybody, each employee gets a very nice ID card. It's made by the same people that make the American Express Black Card. It sits in your billfold. We like to think of ourselves as, we're to telehealth what AAA is to roadside assistance. So, we may have some roadside assistance programs that we get through our credit card or OnStar or whatever, but a lot of us still buy a AAA-like roadside assistance. And we have that card in our glove compartment, so when we need it, we're on the side of the road, our spouse or children are on the side of the highway. It's like, hey, keep this card handy, call these people, this is what they do. That's what we are at HealthiestYou as it relates to telehealth. So you've got the fulfillment, we have marketing, our partner portal, as Scott went through, is extremely user-friendly. We've got our customized wellness component. That's another touch point, an opportunity to feed data, to connect with the members. We have a retention team. We are really proud that our persistency is well over 90%. I don't know that any other telehealth company in the country can talk about those kinds of numbers. So people are seeing value in what we're providing because they're renewing with us. We have our prescription drug tool. We've got the new app coming out, which Scott alluded to, which is going to be, we believe, game-changing in the industry. We are doing lots of things, from emailing in our wellness program, texting, a monthly newsletter, and then, of course, you, the broker. You are our greatest champions out there. So you're out there talking to the customers, educating them, and we are, that has a tremendous impact on the utilization of the group. So I would just tell you, after being here now, this doesn't surprise me. And we actually think there's going to be much higher utilization in the future with the new smartphone app, because that's going to be at everybody's fingertips. So how do you position HealthiestYou out there in the market? And this, I think, is really interesting, because I've talked to lots of brokers about how are we being sold in the market. And I think what's interesting is, with HealthiestYou, we've kind of turned the whole thing, the whole benefit offering, upside down. It starts with HealthiestYou. You enter the healthcare system by calling the doctor. Generally, we're no copay, so it's free for the member to call the doctor. So we're the entry point. Then, following HealthiestYou, now you've got your medical, which most medical plans today are more catastrophic in nature. And then you have all the specialty products, which, of course, I've done for 30 years in my career, are near and dear to my heart, but they're after even the medical. So when you think about HealthiestYou, we really do sit right alongside of the medical. If it's a fully insured plan, what a lot of you are doing is you're working with the employer who maybe is facing another rate increase on their medical. You're maybe working with them to raise the deductible, to increase the copay, so they actually decrease their premium. And then you're saying, now, give the employees HealthiestYou for 70% of the reasons they're going in to see the doctor. It's now free. So the doctors are waiting for them versus them waiting for the doctor. And in addition to that, what a lot of brokers are doing is saying, hey, for that additional money we're saving you, Mr. Employer, maybe we buy some other products. So maybe you're selling them a critical illness, accident, hospital indemnity, another product. So we are, enabling you to potentially increase your revenue by customizing, tailoring a benefit program for the employer like you've really never been able to do, because you have our product, HealthiestYou, to sit alongside that medical. If it's a self-funded product, I hate to use the phrase, it's a no-brainer, but in a lot of ways it is. If the employer understands those redirection of claims, those are just claim dollars going right back in their pocket. Now, there is another way you might see HealthiestYou out in the market, and there you are going to see some payers, some TPAs embedding us, where all of a sudden we become part of a standard benefit offering. In those situations, perhaps, you're not getting commission directly from HealthiestYou because you're getting paid to write that particular product. but your customer's experience is going to be the same. I mean, one of the things we're adamant about whenever we do work with a payer is that we still are able to do the things that we do so well with the group to drive utilization. So that's how I think about it when I think about positioning our product alongside of the medical. You know, back to this whole notion of redirecting claims. You know, this is so critical because the real savings we are bringing to the employer is lowering those claim dollars. And we provide great utilization reports to the employer so they can see exactly how many people are using our services and what claims are being redirected. But here's an example of a group. They were with a major competitor of ours for a couple years. They were, you know, realizing the usual 2-3% utilization. They kind of looked at this telehealth offering and thought, gee, why am I really even doing this? Nobody's really using it. And the broker sat down with them and said, well, why don't you think about HealthiestYou? Well, you know, it is true that the PPM that we were going to charge was higher than that 2% utilization company, but the reason our PPM is higher is because of all the utilization and all the efforts that we're putting in to drive that utilization. And look at this, after 1 year, this employer saw, if we go to the right side, a 37% decrease in primary care, urgent care, and emergency room visits. With our pricing, that's about $14,000, $15,000 of premium for this group and a $30,000 savings, a 200% return on their ROI in the first year. And something we don't talk enough about, which is so critical to an employer, is productivity savings. Look at over on the left side, 2.2 fewer PTO days per employee. You know, if you can sit at your desk and make a quick call on behalf of a sick child or yourself, and you don't have to take a half a day off of work, think of what that savings is to the employer. And again, as Scott said in our ROI calc, we touch on that. I mean, we definitely outline that. But there's just all these savings that are occurring because of what we're doing at HealthiestYou. This is a bit of a larger group, but it's an interesting one as well. If you look at this, you know, the old plan had a copay of $25. They tweaked it to a $35 copay. Urgent care went from $50 to $75. ER deductible up to $200. Individual deductible up to $3,500 from $2,500, and then the family from $5,000 to $7,000. In year one, we reduced urgent care spend by 37%, $214,000 savings. That was with 44.4% utilization. Plan design savings was 9%. So this is the kind of information and feedback that we are consistently getting from our customers, and that's really exciting. So when we think about HealthiestYou and our ability to redirect claims, you know, it's really a fun story to have with the employer. So how much do we cost? You know, our pricing is extremely competitive for what an employer is getting. So this is our most recent street pricing: $9, $2 to $99, $8, $100 to $249, $7 up to $500, and then $6, $500 to $1,000. And then if we get over $1,000, please give us a call. Let's talk about it. We want to look at that group, and we want to analyze it, and maybe the pricing can even be lower than that. When you think about this pricing, it includes the no consult fee. It includes all those engagement tactics that we are deploying on every group. It includes a reach out by our retention team to every group to understand what it is that we can do to help drive engagement. Do they need magnets on the refrigerator, magnets off their truck drivers, in their cab? What is it that we can do? We tell one of our groups, we like to tell a sort of a funny story that they happen to have sort of an advertisement in their bathrooms, and they call it the Whiz. Well, guess what? We worked with them, and we have a HealthiestYou advertisement on that. We want to do whatever we can with that group to drive that engagement. You know, Scott mentioned earlier that we sell to individuals as well. That pricing isn't on here, but just so you know, for an individual, it's $11 an employee and $15 a family per employee per month. And you know what's really, I think, fun about what we do at Healthiest You is that we cover such a broad spectrum of segments, from the individual all the way up to the national account space. And that's really fun. So when you think of our pricing, don't be fooled by lower prices up front from our competitors. You've got to think utilization. I had a conversation with a broker once, and the comment was made, well, one of your competitors also has a capitated rate. So again, no copay, an all-you-can-eat buffet. And it was a lower price point than ours. And my comment to them was, okay, so let me think about this. What kind of utilization are you seeing? And they said, well, there's a 7% utilization cap, but we've never come close. And I just had to pause and say, okay, so think about what we're talking, what you just said. Yes, the PEPM's lower than ours, but nobody's using it, or very few people are using it. Yeah, okay. Well, then how many claims are you redirecting? How much money are you really saving that employer in primary care, urgent care, and emergency room visits? Very little to none. So think about Healthiest You. We're coming at it a very different way. Yeah, our PPM might be a little more upfront, but we're much less expensive in the long run when you look at the overall plan of the employer because of those redirection of claims. So as you think about the pricing, please, look under the hood. There's a lot more to it. And again, I'll go back to persistency. People are renewing with us. We're adding value to groups. And that, is the real testament of success, is the fact that people each year are signing back up with us. So those are some comments, some observations in my first 5 months. Excited to be here. Think the sky's the limit. Think we can work together with you to really bring value to your customers. And when I think about the win for your employer, your customer saving money, I think about the win for the member, now not having to run to the doctor in the middle of the night, being able to pick up the phone, video with our new smartphone app, see a doctor. When I think about the win for you, you've now made additional money. This is like another specialty product for you. Maybe have freed up money to sell other product that meets the customer's needs. The customer views you as a very consultative, technical salesperson that's brought a very innovative solution like Healthiest You. I think it's a win. So it really is a win-win-win. And I just, before I hand it over to Jesse, I can't emphasize enough, take advantage of our sales team. We have excellent salespeople like Jesse that want to do presentations with your customers, want to do webinars with you and your staff. They're there to train you, whenever, to work with you, to help you with ROI calcs. What we are finding is when a broker brings a Jesse, and Scott and I were just talking about Jesse, one of our new brokers brought on recently got involved with us and asked Jesse to present 6 very nice cases, and we've written all 6 of them. I had to give Jesse a little grief. Can't quite understand why he can't get 7 out of 6, but no, in all seriousness, he's batting 1,000. So let us help you work with your customers and do presentations. And even if it's we've got 12/1 and 1/1 coming, the busiest time of the year. I know it's crazy for you, it's crazy for us, but right now is the right time to be talking about us with the customers. Don't shortchange what you're bringing to your customers. If it's off anniversary and we get into next year, that's okay. Our product is the type of product that's so easy to sell, it's so easy to implement, that you could add us off anniversary or throughout the year. But really, the opportunity when that employer is making that key decision on 12/1 and 1/1 is right now. And so as I conclude, I'll just tell you it's been a lot of fun. I hope you're having fun with our product. I hope your customers, the feedback we're getting from them is they love it. It's exciting. And so with that said, I just want to say thank you again. Let us know how we can help you down the stretch here in the 4th quarter. And I will hand it over to Mr. Jesse Lisson. Jesse, are you there?
Yes, sir. Thanks very much, Pat. Thanks everybody for taking the time with us today. And I think, to echo what Pat said, our goal, our job, my job is to help you. That is literally why I'm here. So we want to help you introduce HealthiestYou to new clients with proposals, help with ROI reports, really anything we can do, flyers. And, to Pat's point, the group he mentioned, we've been working together for about a month now on presentations. We've done a total of 9 presentations. We have 6 more coming. Of those 9, 6 have closed and 3 are being discussed. So moral of the story is, when we can work together, we're going to help you close business, plain and simple. And we truly love it. That's my favorite part of my job is helping. That's what we want to do, is help you. And that, the nice thing is, once you close business, we're going to help you with that. We're going to help you retain that business, right? We have a team here that's sole purpose is to keep that client on the books. So just know that we're here in support. We're here to help. And we really do appreciate all your hard work. Understanding now is it's that time of year, right? But we're excited. It's going to be a sprint. It's a lot of fun. And do not hesitate to reach out when there's anything we can do to give you a hand.
Thanks, Jesse. Scott Sanford here. Just to kind of wrap up, again, appreciate everyone joining. There's a few questions I think we'll address quick on the chat box so everybody can hear. Our team's been responding to these as they're coming in. So good questions coming through, but some of them we'll address to everybody just so everybody gets the answers. The big one, can you talk about commissions? That's a big question that's come up. Yes, we pay a 15% commission based on that PEPM for as long as they're a member on the books. So it doesn't decrease year 2 or year 3. It's a level commission, 15%, nice little icing on the cake for you for that particular group and that benefit plan. Also, keep in mind, big trends happening right now with employer groups paying for this benefit for employees that are not taking the health insurance. Okay, so they're outside the plan. They're buying it for them as well, or at a minimum, offering it to them on a voluntary basis for them to purchase. So keep that in mind. If you have associations, groups that have 1099 subcontractors, we just had a huge group come on that's they're all 1099ers. They're not employees, and this is part of a benefit plan for them that's not actually a health insurance solution. HealthiestYou's bundle in there with a couple of non-insurance products, and huge value add there. So you can think out the box a little bit. Doesn't have to be coupled with health insurance. Certainly is a nice fit that way, but lots of people can have access to this, not necessarily right with the health insurance. So good question there on the commissions. Another thing here, does this product require a health insurance license to sell? It's not. We're not a health insurance product per se. So no, you don't need a health insurance license to sell it, although, we basically partner with insurance agencies. So almost everybody selling our product will be licensed in that space just because of our distribution model, but technically you don't need that license. Let's see. Here's a question to see, is the physician network, so there's a question around Teladoc, who's one of our competitors in the space, if you will, a different model. They're a lower priced model, low utilization, low value model. Is that physician network behind this, or is it a network HY has put together on their own? We are not any way associated with Teladoc. That question does come in quite a bit. I'm not sure how that question comes up, but we're in no way, shape, or form associated with Teladoc. They're a different company. We do contract with the doctor network. The analogy we use is Uber, the world famous app that grew to $18 billion in 4 years, that is based around transportation. So Uber connects you with a cab, a black car, an SUV. On Cat Day, they were out delivering cats. Interesting company. We're the same way. So we don't own the cabs. Okay, we don't own the doctors, just as Uber doesn't own the cabs. But what we do is we engage the consumer, we make the experience incredible, and we connect you with the appropriate doctor, whether it's a pediatrician, whether it's a family practice doctor, an emergency room doctor, depending on what your needs are. We connect you with that physician. We connect you with good wellness content. We connect you with finding the right prices on medication. January 1, we're going to be connecting you with pricing transparency for different procedures, all kinds of other different features. So think Uber. We don't own the doctor networks. We don't want to own the doctor networks. The value is not in the doctor networks. Doctor's a commodity. The user experience is the value, just as it is with Uber. So good question there. Let's see what else we got here. Commissions we covered. Are we looking at a price increase? January 2015, no intentions of a price increase. The app's going to be interesting. The app could drive up utilization substantially because the user experience is going to be pretty incredible. If that happens, it's a win-win for everybody. At the end of the day, if we have to raise our prices at HealthiestYou, there's so much money being saved out of the health plans that would be a huge success. So our goal is to hopefully have to raise prices, because if we do, our utilization's off the charts, and there's so much more money being saved for the employer group and the employee that we've done our job. We have a question here about some VIP memberships. If you've got a big group and an HR director wants to try out a membership, can we give them a free membership trial? Absolutely. Just give us a call. We're happy to let them try out and get a little taste of HealthiestYou. We'll certainly support you there. Let's see what else. What other questions we have? I think the other ones we pretty much have addressed. Let me take one more peek. Okay, do you ask for Social Security numbers in enrollment? We don't ask for Social Security. That's not one of the fields we require to enroll a group or an individual. That's a good question. We can do certainly EDI feeds with larger groups, API feeds, which is real-time eligibility, or smaller groups. We can work off just census files and so on. We're pretty flexible on the data. Okay, I think I hit most of the questions. If I missed you, feel free to email us here, support@healthiestyou.com, or you can call us on our broker support hotline, 602-663-9595, or right here in Scottsdale, Arizona. If you're local, want to come see us, we'd love to have you in, meet the team. And, you know, we just really appreciate everybody being trailblazers out there in this industry. Somebody's got to lead. Somebody's got to stop doing the old school, outdated benefit plan designs and think outside the box. And I think that's why everybody's on this call here, and that's what we can help you with. We can help you grow that business, retain more business, differentiate yourself. And at the end of the day, we like to have fun. You know, we're just kind of grown-up kids here at HealthiestYou, trying to bring some good solutions to the market. So we're going to have fun doing that. We made Pat take off his tie and loosen up a little bit from that 30 years of corporate experience. It's been so valuable for him to bring to us. But we like to have fun. We're going to make that conversation a little bit different for your group, and bring a solution that just makes a ton of sense. So thank you, everybody, for joining today. Really appreciate you. Love to hear from you. Email us, call us, let us know how we can help, and let's have a great, busy season here, November, December, January, and bring lots of people into the HealthiestYou world. So thank you all so much. Have a great rest of your week.